we're back. Good afternoon once again to everyone watching us today. And I hope that you learned so many things from our first two speakers po ngayong hapon. But before we proceed to more learning sessions, we would like to say hi to our friends to Magete and the Sikihor who is joining this afternoon. Hi guys! Magandang hapon po!
Hello.
Hello.
Good, we see a lot of them. They're actually
Hello, good afternoon.
hi. So a lot of you guys are actually watching us live. So guys, we see you. The entire country sees you. Especially our audience po na nakaupo dyan. Maybe you can wave your hands and say hi. Ayun. Sabay-sabay natin sabihin, we are here. Ayun. Thank you so much for joining us. DTI Dumaguete and DTI Sikihor. It's so nice to see your warm support. And because of that, I am pretty sure that we are all ready to recover. Grabe! Amazing yun kaayo ang technology. It's super amazing na kahit hindi po tayo pwede magsasama-sama sa isang place ngayon, you're still able to continue the learning sessions through our broadcast. So salamat talaga that this is all happening because of technology this afternoon. So, guys, to put everything into perspective, everything we learned into context, we will get the chance to learn from the model city in the country that was commended by the World Health Organization for their local COVID 19 response and contact tracing strategies. So, guys, this city is a model city that has been commended, and we're very happy to be listening to the Baguio City contact tracing model, and it will be presented to us by no other than Baguio City Mayor Honorable Benjamin Magalong. Take it away, Mayor Magalong.
Good afternoon, Bea. Good afternoon, everyone. By the way, I have with me Dr. Panes, who is who is the city epidemiologist, and he will do the presentation. So please sit tight and relax. Donna, please take charge. Thank you.
So thank you, Mayor Benji. Thank you, Bea, for that very kind introduction for Baguio City. It's good that we're sharing our experience in the city of Baguio because under the leadership of our mayor, we were able to push this contact tracing into a higher level. So let me share my slide to you. So I entitled my slide as the contact tracing the Baguio City experience, sustaining what works, and we have innovated. So we will innovate, of course, for the better. And this is the game plan of the national government in terms of the of COVID-19. All of the government and all of sector approach, iisa lang naman po ang goal natin, which is of course to reduce COVID-19 related deaths. At the end of the day, we just want zero death in this particular disease. And how do we do that? We have a sub goal of preventing disease and managing our cases as well. And below those goals are different strategies that we need to do, and one of which, of course, is the PDITR, of which what we can see here is the different strategies to achieve the goal of decreasing morbidity and mortality on COVID-19, which is to prevent, detect, isolate or quarantine, test, and treat. And of course, one of the under the detection part is contact tracing. And contact tracing is not new in the realms of public health because this has been observed back then. Kung alam niyo po yung sakit na nakita na po natin ang action ng contact tracing back in the as early as 500 years ago, when this woman named Mary has been infecting other people without knowing that he has sickness, and they were able to identify Mary as one of the carriers, and that's where one of the famous contact tracing has been done. And even before the onset of discovery of the vaccine, you can look here, ito po si Edward Jenner, one who produces the vaccine. Bago po siya nag-produce niyan, ang ginagawa naman po noon bago ang vaccination ay contact tracing. At what they do with contact tracing is that they identify people who have been in contact with a sick person, put them on quarantine, and that's where they were able to stop the transmission of the disease. And now it has leveled up. Contact tracing that was presented before me, that electronic, we have a new electronic eyes in terms of this pandemic, what we call the digital tools that we already that has been developed and has been a good way also, a good innovations in terms of contact tracing. But there's a research being done as well. There's a research being done in UK of how would people prefer to be contact traced, and the study has shown that a combination of apps and human touch would still be the preferred one. So while we are doing some digital innovations in terms of contact tracing, we would like to assume that human touch would still be one of our strategies in contact tracing. And contact tracing nga po, as mentioned po kay Dr. Nina po kanina, is the prevention of onward transmission of the disease by identifying a person who may have been exposed. So wala pa pong sakit. Wala pang sakit itong pasyente na ito, kina-quarantine na natin sila. And those who are sick, we are already isolating them. And because of the long incubation period nga po na sinabi po kanina ni Mamina, ganun din po katagal natin silang itatago. Itong pasyente na ito, ika-quarantine po natin sila. And what is contact tracing? It is a means of finding everyone who came in close contact with our cases. So it doesn't have to be a confirmed case. Pwede pong may symptoms lang siya, pero na-expose previously to a confirmed case, pwede na po nating kasama na po siya sa contact tracing. And why do we have to do this? It has been proven time and again. It has been an effective public health intervention to reduce infections in the population and stop the spread of COVID-19. And people who are in close contact with this confirmed suspect or probable cases are at high risk of becoming infected. Thus, we have to quarantine them. And these are actually the major steps that we do in contact tracing. We identify and list those close contacts, inform and profile close contacts, and manage and monitor that close contacts. But we have in the city of Baguio, which we would like to highlight later on, is how we have used tools and analytic tools to guide our local chief executives and our lawmakers in coming up with the day-to-day decisions, because we can analyze our cases across time and space. And when do we do this? Actually, we don't need laboratory confirmation to start contact tracing, as long as there's a high index of suspicion that you already have the virus. Probably as you're a suspect, contact tracing should be started immediately. And as I've mentioned po kanina, contact tracing is a whole of government, whole of society, and whole of sector approach. Everybody has to pitch in to make contact tracing works. Okay? And for this contact tracing to work, actually, we want to move forward by coming up with a more comprehensive contact tracing, by not just identifying close contacts 2 days before the onset of symptoms until 14 days. To break the chains, we can actually go back 2 weeks before the onset of symptoms, not just forward po, but it's just identifying. We go back and identify possible sources of infections, the link to cases in a certain settings. It could be in a mall, in a workplace, in a public transportation. It could be an event po. Pwede pong mga trainings and seminars, burials, and other parameters that we can use to identify possible sources of the infection. And we analyze this exposure and possible identifying hotspots and avenues. And in that way, we can already initiate non-pharmacologic intervention measures so that we can mitigate the resources. And there are policies po that guides us in terms of implementing contact tracing in the workplace, which is the joint memorandum circular of the Department of Trade and Industry and the
To
Department
shed
of
light
Labor
on the
and
process of
Employment
treating deceased
in
patients
terms
suspected
of
of
implementing contact tracing at the workplace, of which you can see in front how will this be done, and how we can link those contacts with the epidemiology and surveillance unit. We are guided, of course, with the principles among contact tracers, the compassion and teamwork. Ganito po kami magtrabaho dito sa Baguio City. We're guiding by the principles of compassion and teamwork. And for the patient, we are also expecting them to be cooperative and be transparent also in their history, even as we continue to contact trace them in the city. And this is, in a nutshell, in a snapshot, this is our COVID-19 incident management workflow. And the city team, the contact tracing team, would start their work once a confirmed case has been announced, and it will be through the mayor. No, we have a very unique management workflow in the city because we have our mayor on hand in all of the processes that you see here. And hands-on po si mayor namin. He can call our cases and even comfort them. And, iba pa rin po kasi pag a leader would do that. And that would really convince these people for full disclosure. The full disclosure would really, we have seen time and again that full disclosure among the patients would help us in our contact tracing. And once the mayor had informed the patient, sunod-sunod na po, simultaneously, the team, different teams, the local interagency task force, management committee, even the Sangguniang Panglungsod, and all the key decision makers in the city will be informed of the case as well. Together with that, there will be an ordering of quarantine protocols, including household lockdowns or barangay lockdowns, of which the PNP will be taking charge of this by deploying their security teams. Together with that, the patient can, help us in facilitating the contact tracing by full disclosure of their identity, and the Public Information Office will set out their post on that. Our contact tracing doesn't stop with just merely interviewing the patients. It's an end-to-end one. We want to connect these confirmed cases and their close contacts to lifelines, like if they need a transportation to the higher facility, they would be needing food to eat on the table, decontamination. They will all be part of the contact tracing framework that we are doing. So, kompleto po, hindi po to piecemeal na pag nag-contact trace na kami, after that, bye-bye, hindi po ganon. Kompleto po ang services that we give to our patient. And there are guiding principles that has to be, that we have been practicing in the city of Baguio. The first one, of course, is that there is a seamless collaboration between law enforcement, investigators, and health authorities. If there are people here who are listening na nasa health sector, it's time that we have to move out of the box because we are in pandemic times. We need to have to work with other people outside the health sector. This might be uncomfortable at the start, but in the end, it's a win-win situation, both for the safety and health of our constituents. And we have seen how the law enforcement and investigators and health authorities in the city who has been working together, and we were able to achieve the goals of contact tracing. Of course, transparency and speed are indispensable. We want to exhaust as possible all contacts of our patient, and as na-mention ko po nga po kanina, we are expecting that patients would be transparent. And what we have created here in the city is a culture of transparency, such that even the people themselves, no, sila na mismo magvo-volunteer to disclose or volunteer even to tell all the close contacts. No, iti-text talaga nila yung close contacts nila, oh, may positive ako, you have to stay on quarantine kasi positive ako. It's a culture that we have created in the city, and that we have it as our advantage. Speed is indispensable in contact tracing. I think it was reiterated a while ago, because every second matters, and not every day matters. The third one is that this is the one that we would like to emphasize, that establishing a very good contact tracing parameters would mean a very skillful person doing the cognitive interview, and it is the key to efficient collection of information. The less we can get from the patient would mean the less contacts we can also isolate, but the more we can exhaust from the patient, the more we were able to stop the movement of this virus forward. So it is very important, there has to be in the team a skillful individual who can do the contact cognitive interview, and of course that is of course the competency that our law enforcer has. The fourth one is that we use technology even before the digital app has came out. We already have in place analytical tools and GIS platforms that we have used. And these platforms has been our key tool in our day-to-day decisions, day-to-day activities, and other. This has helped us in our decision-making tool. And successful contact tracing is highly dependent on the quality of information. Garbage in, garbage out. So, importante po at the start, malinis na ang datos na kinukuha natin sa mga pasyente natin. So, we have to establish that from the start so that we will be able to come up with good decisions based on that quality of information. There is no substitute for being proactive. I think it is one of the core values of a good leader and a good decision maker and a manager, to see beyond, to have a foresight of what's going to happen. And it is indispensable also in contact tracing. At this point, I would like to emphasize that the local chief executive has played a major role in contact tracing, and it has to be that leadership that we would like to see across all the nation, on the local chief executive really having a hands-on and really have a major role in contact tracing, and extensive testing as well. The testing that would give us the intelligence of what it is to be done, the next step, would also be critical in contact tracing. And since this pandemic is not an ordinary one, it needs also an extraordinary solutions. While this is not a local issue, it also is a global issue. It also needs to have a global solutions and innovative solutions as well. So what we have introduced here in the city of Baguio, the mayor has introduced here, is what we call the contact tracing ecosystem. And these are composed of skilled health workers and analysts and coders, technical support and community support system working together with the goal, of course, of preventing the forward movement of the transmission of the disease. Okay, so we would just want to look at this later on as we move on with our discussion. So these are the apparently the one that we would like to suggest, that the contact tracing interviewers has to be like at 20 cases and below would mean we would need 2 to 3 teams per case. So that would that would mean we have enough of these city interviewers, because we have this projected number of cases every day. In terms of the analytical tools, we need analysts at this point. Sabi ko nga po, this is an out of the box health event, so we need out of the box solutions as well. And this is where we have seen how our analysts have played an important role in giving us a good and deeper analysis across space and time. The encoders, though you might not see them, but they are the ones behind those dashboard that we have. You can visit that as well. They play a key important role in our contact tracing ecosystem. The same way with our IT personnel, they have been instrumental in all of this, linking all the contacts together up to the hospital, up to the community, and even our LSIs. They are all part of that information system that we have formulated so that we can monitor the virus. Actually, what we're monitoring here is not really the people, but the movement of the virus as well. And I would like to emphasize how critical the work of the Barangay Health Emergency Response Team is in monitoring the cases in the community. We have to realize that we have to monitor these cases for 14 days, and that would mean keeping them inside their houses in that 14 days, and that is a very tough job on the part of the BHERT. So if you saw somebody na mga BHERTs po, you just give a tap at the back and say thank you to them. They've been also working hard in the fight against this pandemic. We have included the swabbers as one of our critical members of the team, which, as I mentioned, we they can be also of help because they identify the next step of where are the cases are. So what you can see here are the e-system that we are using, the contact tracing e-system, and we have 3 of them. We have the data collection tool. Apparently, this is the mirror of the case investigation form of the Department of Health. We just modified some of them because we want more responsive to our needs in the city. So I will show it to you later on. Our geographic information platform and our analytical tool, which you will appreciate as we move on with our discussion. So basically, this is our data collection tool. We have been modifying this based on we think are more pertinent in our analysis of our cases. So we have actually a third version of this already. We have included geolocations as part of it. The other pertinent informations in terms of exposure and contact tracing, we have modified it to meet our needs in the city. So once the data collection tool are there, they are put in this system, our main database. Dito po kami nag-input ng mga cases namin. And what you see here, the colored rainbow, are the indicators or parameters where we like put on the history, yung contact tracing po yan, some details of the patient, the result of their specimen, how they are linked together, and so on and so forth. So this is a good one. If you would like to click on that link there on history, we can actually do some linking of our cases. So ito yung sample po ng interview portion namin on the date, the time, is there transport, the places of engagement. It's basically identifying areas or settings where this transmission has occurred. And if you could and here you can visit this page po, the egov.baguio.gov.ph and gov.baguio.gov.ph, I should say. This is our dashboard. It's a real-time data. So we are really transparent in the city kung ano po ang nakikita nyong numero dyan. It's updated daily so that the public may know where we are, and it becomes everybody's scoreboard of where we are in our fight against this pandemic. What you can see here, actually, you can also check this in that website that we had. It is color coded. You can look at the cases based on their epidemiologic classification as suspect, probable, and confirmed. And some of them have recovered. You can appreciate more of this. But this is analyzing disease across a space. In that way, we can identify possible areas of lockdown and some containment strategies that we need to institute as well to contain the virus. Okay, so this is actually some of the this is a video of our information system. What you can see here, you can choose on what classification you would like to see. Would you like to see suspect, probable cases, and confirmed cases? Do you want to see active cases or recovered cases across a space? Then this map is very, very helpful as well. Okay, so that's being transparent as well, without, of course, compromising privacy and confidentiality of our patients. Okay, so this is the tool that our mayor has introduced, and we have used it to our advantage. Talaga namang we have maximized our mayor talaga, no? Even in this pandemic, he has introduced this analytical tool, what we call the link analysis, of where patients are connected together. And what we have seen here is that most of our cases are not random, and they are not like dito yan, dito yan. We have seen the links of these cases through this analytical tool, and this has been very helpful to us. It gives us a foresight because we know where the next cases are, because as I've mentioned, cases are not randomly distributed. They can be predicted because we have used analytical tools, this link analysis, to analyze where the next cases are. In knowing where the next cases are, we can prevent the transmission of disease because we can institute already some policies and measures to prevent the forward transmission of the disease. This is a very good, if I may show you this video, you can actually, when you click on this video, you can actually see some details of this patient, of where they are, where they live, did they have symptoms, were they tested, what are their symptoms, how are they linked together with the different contacts and the different positive cases that we have documented. So it's basically putting our close contacts and confirmed cases in a way that we can appreciate them and analyze them, because sabi nga ni May, as always, we cannot analyze this kapag we just human brains, and putting them in a special tool like this would help us with our preventive measures and non-pharmacologic interventions as we move forward. Okay, so we have also used different platforms to communicate together, how the central command and the field workers communicate together so that we can the system in place at a very short time by using platforms like Viber and Messenger to, inform of what is happening in the field. And this has been our one of ways to communicate together. Okay, so I'm ending po with last few slides of where we have started. This is our humble beginning. This is our contact tracing operations back then March, April. This is how it looked like, and this is how it is now. We have leveled up our contact tracing operation center thanks to the leadership of our mayor, and we have been recognized by the World Health Organization as one of the best practice in contact tracing across the nation and across the world. So this is how we are now. Actually, nandito po ako ngayon sa operation center namin. This is where we conduct our trainings. This is where we come up with our daily decisions, some critical decisions that we need to make. And this is also we conduct our virtual solutions forum, we call it. And this is this room have witnessed a lot of our challenges and struggles and our victories in terms of our contact tracing. I think that would be all, and what we will shown you here are the good comments that these patients who have disclosed their identities. And kung makikita nyo, mas marami pong nag-appreciate. Prayers have been flying out in the social media because these people have been transparent in their situation, and the netizens have been supportive of their disclosure as well. Lastly, I would like to tell you, this might be a very complicated graph, but what we would like to show you here is that how we have avoided cases of COVID-19 because we have instituted different measures in the city. The color red one po are our expected or projected cases. Kung nakikita nyo yung red one po, yan po dapat ang kaso namin on a day-to-day basis. Like for example, today dapat ang kaso namin is about 38 cases. The one you see in blue is our actual cases in the city. So the one in between are our cases that we have avoided and we have prevented because preventive measures, non-pharmacological interventions have been instituted, have been placed, and have been passed. Policies have been passed, so we were able to detect this number of cases. And looking at this graph, our 2-week growth rate, we have seen here, ito pong colored maroon, our 2-week growth rate has been decreasing for the past 2 weeks. And as we open our economy and institute different measures, we hope that we can avoid more cases in the future because we have instituted an effective yet cheap non-pharmacologic intervention, which is of course contact tracing. So I think this is the last part of our presentation. In a nutshell, in a snapshot, this is how we do contact tracing. It's an end-to-end process of identifying cases, and we make sure that it is connected, our patients is connected to the different lifelines, and they are reintegrated into the community. So this is Baguio City's experience on contact tracing, and we hope that we were able to share our experience, and you can adopt measures that will be possible in your local government unit as we move forward in the fight against this pandemic. Thank you very much po for listening.
All
Go
right.
back to you, Bea.
All right. Thank you so much for sharing with us insightful strategies in contact tracing, Dr. Donnabel Tubera-Panes. And of course, to Honorable Mayor Magalong, thank you so much for joining us this afternoon. We are also inspired by your example, and I hope Region 7, as well as the other regions within the country, will be able to follow Baguio City's effective contact tracing. Thank you so much. So guys, again, don't forget that if you have any questions about the topics that you just learned, the sessions that you have just listened to, stay tuned because later on some of our speakers will be joining us for a panel discussion where we will be able to interact with them. I see the comment section. I see the comments also shared by a Zoom webinar at alam kong ang dami-dami yung tanong. So guys, just chill. Wag muna kayong mag-log out kasi marami po tayong opportunities later on to actually ask our panelists some questions. Once again, thank you so much to Baguio City Mayor Honorable Magalong and Baguio City Epidemiologist Dr. Donnabel Tubera-Panes for that very insightful discussion. Guys, time check. It is 3:45 in the afternoon and more information is coming your way. And to prepare yourselves for that, we are again going to go on a 1 minute break. I'll see you guys in 1 minute.